Addison's disease and treatment considerations in dental hygiene. Our objectives for today is understanding the foundation of this condition and how it relates to dental hygiene. What is Addison's disease? Addison's disease is a rare endocrinal disorder, also known as primary adrenal insufficiency, or PAI. It affects the adrenal glands by disrupting the production of cortisol and aldosterone steroid hormones. It results in important oral manifestations, signs, and symptoms that are related to our practice. If the condition is recognized and controlled, it's classified as ASA2. If it is undiagnosed or poorly controlled, it becomes life-threatening, making it ASA3 or 4. And this is just a short visual.
Primary adrenal insufficiency, also known as Addison's disease, is a rare endocrine disorder that happens when the adrenal gland isn't able to produce enough of the hormones that the body needs, particularly aldosterone and cortisol.
Causes and risk factors of this disease. It is a rare condition, but it's important to know that it can affect all ages and genders. Many pathological processes are known to be associated with this condition. Tuberculosis and autoimmune adrenalitis are by far the most common known associations. Other infectious diseases are also associated, such as HIV. Other causes include genetic susceptibility, fungal infections, hemochromatosis, metastatic neoplasm, X-linked adrenoleukodystrophy, hemorrhage, sepsis, malignancy, adrenalectomy, and certain drugs and congenital disorders. Diagnosis and treatment. Diagnosis is usually tricky because it is usually misdiagnosed since the signs and symptoms are so similar to other conditions. If it is suspected, an abdominal CT and blood tests are usually taken. Addison's disease cannot be cured, but it can be managed with standard initial hormone therapy or corticosteroid replacement. A patient with Addison's disease will need to take medication for the rest of their lives and modify their doses based on anticipated stress. What questions do we need to ask? If a patient presents with Addison's disease, we need to be asking what type of treatment are they on? Have they been taking their medication? Have they taken it prior to the appointment? How is the patient feeling today? Have they had an adrenal crisis in the past? And are they currently wearing an Addison's disease emergency bracelet? Symptoms include nausea, vomiting, fatigue, weight loss, hypotension, mood and behavioral changes, and loss of motivation. Why do these relate to dental hygiene? Nausea and vomiting are concerning because it can cause acid erosion in the enamel, which can cause loss of functionality in the dentition, as well as lower the self-esteem of the patient. As dental hygienists, we can recommend drinking more water and recommend an anti-sensitivity toothpaste to help combat this issue. Weight loss and hypotension is concerning for any medical emergencies that may occur, such as syncope. So as dental hygienists, we can be aware of this and take the necessary preventative and emergency actions. Behavioral and mood changes may require the use of a pain and anxiety management option. Nitrous oxide is a great option because it is not contraindicative to Addison's disease and it does not cause a big stress on the body, which is important to lower the risk of an adrenal crisis occurrence. Loss of motivation may cause a lack of self and professional oral care. It's our job and responsibility as dental hygienists to educate and motivate the patient using lay terminology. Signs include hyperpigmentation, also known as bronzing, on the skin and mucosa. It's usually seen on more sun-exposed skin and pressure points such as elbows and knees. And vitiligo is also seen in some patients, which is more of a paling. Why are these related to dental hygiene? Hyperpigmentation can be found anywhere in the oral cavities such as the mucosa, gingiva, alveolar process, hard and soft palate, tongue, and lip. Because we are head and neck specialists, we can be the first to recognize that a patient has this condition. This is very possible because hyperpigmentation is one of the first initial signs of Addison's disease. As dental hygienists, we should always be doing a thorough head and neck exam and making sure to document these findings if they're present. This is just a short video of a patient with Addison's disease discussing how she needs to change her doses.
What Addison does is it doesn't let your body produce the hormones that you need to balance the stresses of daily life. I have to pay a lot closer attention to my body. Not just it's in the background, I really have to listen to it. And I have to adjust my medicine accordingly. I have to pay attention to the stresses in my life and the activity levels. I have to eat better. You really have to schedule out time to rest and time to regenerate and give your body the downtime that it needs to kind of function. There are a couple of
Okay, so as you saw with this patient, she was talking about how she needed to change her doses based on anticipatory stress. And as we know, dental settings have kind of a notorious stereotype of being very stressful, so a patient may need to change their dose based on how stressed they're going to be. Medical emergencies include syncope, as we discussed earlier, but adrenal crisis is the most major concern. This occurs when a patient has stopped treatment or took a low dose and the body is unable to secrete the sufficient hormones during a stressful situation. If it is not recognized and treated, it can result in hypovolemic shock and cardiovascular failure. And signs and symptoms to look out for if a patient is having an adrenal crisis occurrence is a fever, gastrointestinal discomfort, hypotension, elevated heart rate, excessive sweating, and syncope. Modifications to care. An association has been studied with anesthetics containing barbiturates and an adrenal crisis occurrence. So we need to avoid using anesthetics that contain this. And the dental hygienist should monitor vitals throughout the appointment, as a drop in blood pressure and elevated heart rate can indicate an adrenal crisis occurrence. Calling for emergency care if an adrenal crisis occurrence happens, and making the patient feel at ease and comfortable throughout the appointment and look out for signs and symptoms of a crisis. The takeaway points I chose for Addison's disease is just taking all the necessary measures to prevent an adrenal crisis, because it is fatal. This includes asking if they've been taking their treatment, if they have taken it prior to the appointment, if they've ever had one in the past, looking out for the signs and symptoms of an occurrence, and being ready to call for emergency care. The other takeaway point I have is just being aware of the signs and symptoms, knowing that hyperpigmentation is seen and normal. And if the patient is experiencing changes in mood and behavior and experiencing depression, it is our job to motivate and educate them and providing support. References.